I already said in a previous presentation that depression and schizophrenia contribute the highest proportion of burden in terms of mental health disorders, even more than other chronic physical disorders such as tuberculosis and diabetes. This was shown in an immense study published in 2005. So, schizophrenia in addition also creates a lot of suffering and burden to the caregivers of patients who suffer from this condition, and affects the society and the nation as a whole, including productivity because of lost man hours. Why should yoga be useful for schizophrenia? Schizophrenia, the word itself means splitting the mind. The schism is between thought and affect, and also it can be seen as a schism between individual and the society, that it is a connectopathy. It can be both functional and structural, as well as if you look at within the structural elements, it can be frontal and cerebellar, what is called as cognitive dysmetria, and even has been seen as a disconnection between the hemispheres. Whereas the definition of yoga, the epistemology of yoga comes from the word yuj, which means to connect or unite or yoke together, which is the exact opposite of the meaning of schizophrenia. So logically, yoga should help unite some of the disparate elements in schizophrenia. What are the studies that have been done in this area? Till the dawn of this century, yoga had been used as a treatment in many psychiatric disorders like anxiety, depression and other conditions, but somehow schizophrenia was never looked at, possibly because of the belief that patients with schizophrenia may not be able to follow the yoga practices, and also of course whether these people would be able to learn the yoga practices itself was doubtful. But a study by the Swami Vivekananda Yoga Anusandhana Samsthana, a deemed university of yoga in Bangalore, showed that it is feasible